Hi, welcome to an evening with Wendell Potter. Now more than ever, time to end corporate control of our healthcare system. My name is Carol Engelhardt, and I'm a volunteer for Healthcare for All Minnesota, the event coordinator for this event, and a retired nurse. I want to tell you personally that we are very grateful you could come tonight. You know, we're coming out of a pandemic when a lot of people are vaccinated and you can get outside and be with family and friends. So thank you for coming inside to spend a night with us on Zoom. So next we're going to go over our agenda. We're going to cover who we are, what we are working on, an interview with Wendell Potter, with questions from local Minnesotans, and what you can do. So let's go over who we are. First of all, let's talk about our local chapters, nonprofits that are sponsoring this. Health Care for All Minnesota is a nonprofit working to educate, advocate, and lobby for health care for everyone when they need it. Dr. Mark Brocky is our chairman. As you can see, he's a retired family doctor, and you can read more about him there. The next group locally that is sponsoring this event is Physicians for a National Health Plan of Minnesota with two co-chairs, Dr. John Crossan, a University of Minnesota physician, and Dr. Jenny Zhang, a family practice doctor working in the Twin Cities. So as we go to the next slide, well, we need you to help us fight for single-payer health care. These are our groups tonight: Healthcare for All Minnesota, the Center for Health and Democracy, and Physicians for a National Health Plan of Minnesota. We are working hard to work for unequal access to health care as an injustice, and your donation can help us change this. So right now in the chat box, we're going to put up a donation link that you can give, and I'm going to tell you just a couple minutes story about our own Minnesotan. I was having Papa John Colstead, who is a legendary jazz and blues musician, come to my house to plan a concert that he will be doing at Crooners, that a percentage of the profits will go to us. And he's been a long single payer advocate. And so I asked him, Papa John, did you know any musicians that struggled to pay for their health care? And he said, yes, Carol, I did. There was a musician a few years back that kept complaining he was so tired. He was so tired. So we, his fellow musicians, and his family begged him to go to the doctor. And he just said, I just got to keep playing my music. I know I'm tired. You don't understand. I have no health insurance and I'll go bankrupt if I go to the doctor. So one night a few years back, while he's playing music, he literally just collapsed on the floor, and nothing his fellow musicians or paramedics or anybody on the scene could do could revive him. We have stellar heart centers in the Twin Cities, but it was too late for him. It was too late for him, and now he is no longer a father, a musician, a husband, and a valued member of our state. We need to put a stop to this. So won't you go to the donation site we have and give tonight so that we can make a difference? Okay. Well, we'll be moving on. Let me introduce our speaker tonight, who I'll be interviewing. You know, it's amazing. Anybody that gets to know Wendell Potter is just so happy to hear him speak and know what he has to say. And he walked away from his job at Cigna, one of the country's largest health insurers, in 2008, after having a crisis of conscience over the way our health care systems function. He has become a vocal critic of the insurance industry and a leading advocate of reform. Time magazine called Wendell the ideal whistleblower. Bill Moyers called him a straight shooter. Wendell famously testified about his shocking revelations of the nation's healthcare system in front of Congress, and a best-selling author of Nation on the Take and Deadly Spin. I highly recommend that you would read these books. So we welcome Wendell. Welcome, Wendell.
Hi, thank you very much. It's great to be here.
We're also going to show your organization, and that is Center for Health and Democracy. And we want to say a little bit about it because we want people to know they can join and they could donate besides tonight too. So your mission for your organization is twofold: to serve as a counter to corporations, lobbyists, and others who spread disinformation or exert undue political influence on the policy-making process, and to do the democratic work needed to ensure healthcare reforms are enacted. So if they go to this site, am I right, they can sign up for updates for free?
Yes, and please do. The Center for Health and Democracy.org. Thank you.
Okay. All right. Well, so let's go on then to our questions that we're going to start with. Okay. So Wendell, in your book, Deadly Spin, you described going to Michael Moore's movie Sicko, and you went to go to it for damage control. And instead, in the back, you wanted to stand and applause that he got it right. How was this a game changer in your life, and how it changed what you decided to do?
Well, it was clear as I was watching the movie that Michael Moore had been very careful, he and his team, to fact check everything. And I knew that his stories were legitimate because some of them were Cigna stories. Also, Michael Moore is a master storyteller and master filmmaker. Not only was he presenting incredible facts and figures, but he was telling stories that just connected with the audience very emotionally. So I was among those. I'm human. I couldn't not be affected by I think just the emotion of the movie and seeing these stories of people whose lives were on the line, in many cases had been put in jeopardy because of decisions that insurance companies had made to deny coverage for, in many cases, life-saving treatment. One case in particular was a Cigna case of a little girl who needed cochlear ear implants to be able to hear. And Cigna agreed to cover one ear. Her doctor said she needed two, and if she had two, one in each ear, then she would be able to hear pretty normally. But Cigna said no. Cigna said one's good enough. So it's just, and that was just an example of one of the stories that I knew from my own experience was right on the money.
Okay. I have had a feedback that people aren't able to hear you quite as well, so we'll have you step a little closer to the computer.
Okay.
All right. So thank you very much for that, Wendell. And that was very enlightening, especially for people that haven't read your book, Deadly Spin. But let's go on to big money, one of your favorite topics. And in your book, On the Take, you describe that wherever we are and whatever we do, we are influenced by big money. You state in the book, when government is coin operated and America becomes a nation on the take, the nation's needs get set aside like neglected children. Tell us what you mean by that. What is big money and what is it doing to us?
Big money controls a lot more than people realize. And it is the reason why those of us who are in this fight, who've been advocating for single payer health care many, many years longer than I have, it's why we still have not gotten as close as we need to the finish line. I wrote that book because in my old job in the industry, I was very much aware of how insurance companies take our money, the money that we spend, that we send them in to pay for our premiums, how they take a portion of that money to fund lobbying efforts, their propaganda efforts, how they spend huge sums of money to influence the outcome of elections, how they pick favorite candidates and throw money at them, and how those candidates, if they win, are beholden to big insurance companies and other big corporations that give them money. During the debate on what became the Affordable Care Act back in 2009 and 2010, just an enormous sum of money was spent by all the entrenched special interests to influence that legislation. The attempt was, the objective was to kill it. If that couldn't be done, then to influence how it was written, how it took shape. The drug industry alone spent over $275 million on lobbying, which was the most any industry had spent in a single year debating a single piece of legislation. And then when you add in the money that the insurance industry spent, big hospitals, big medical device manufacturers. It was just an immoral amount of money that was spent to influence that legislation. And as we know, while it did some good, it fell far, far short of where we need to be, and to bring more people into coverage and to make sure that people have decent coverage.
Yes, well, thank you for that answer. And it is quite the story for those who haven't heard about that. Well, I follow your Twitter. So the next question is an answer you've given on Twitter. Most of us watched or listened to President Biden's address to the joint sessions of Congress, April 28th. He spoke about the need to address the skyrocketing cost of health insurance in America, which is true. We heard about premiums being lowered, but the untold story is the plan gives billions to the insurance companies. Explain your take on that and what we could do differently.
Well, it goes back, it's connected to my answer to that last question. Insurance companies were able to influence the final shape of that bill in many, many different ways. And since that bill was passed, insurance companies have made money hand over fist. They've had some of the most profitable years since that bill was passed. And last year, the pandemic year, insurance companies, including, and maybe most notably, United Healthcare, that's based in your own backyard there, had the most profitable year in its history. United Healthcare last year made $22.4 billion in profits, which is just unconscionable, far more than it ever made before the Affordable Care Act was passed. And that's not the only reason why it made so much money, but the Affordable Care Act did uh, really just solidify the role of private insurance companies in our healthcare system. The reason that the Obama administration and Congress went along with uh, the way the bill was being written was because they were persuaded by the powers that be in these big companies, these big industries, that if you don't play along with us, we'll throw so much money at a propaganda campaign that nothing will get passed. And there's some merit to that, because I was part of many efforts over 20 years that I was in the industry to kill legislation that my companies did not like. We have a very good track record. So uh, that's that's one answer to that. And the other is that the insurance industry is still donating a lot to Democrats. And they have a lot of favorite Democrats in high places in Congress and in state legislatures. And the other thing that's notable there is that it's not just the premiums that we need to pay attention to. It's important to bring down the cost of health insurance through bringing down the cost of premiums. But what insurance companies have been doing more and more every year is saddle us with out-of-pocket costs that many families just simply can't afford. And so insurance companies are profiting in that way. They're avoiding paying claims that they used to pay.
You know, you mentioned on Twitter that instead of pouring all these millions of money into the insurance companies to prop them up, that wouldn't we have a better time spent expanding Medicare benefits and lowering the Medicare age? Do you want to comment on that? That we could do that perhaps? We could have done that or look at that.
We could have done that, and it should have been done. And fortunately, largely because of Bernie Sanders and a few progressive members of Congress, there is serious consideration at long last to improving the current Medicare program. When we talk about Medicare for all, it's really important to say that we support improved Medicare for all. Uh, we need to have a dental benefit, a hearing benefit, a vision benefit added to the Medicare program, the traditional Medicare program. And we need to lower the age of eligibility. Um, there is going to be a proposal to lower it to age 60, which is what Joe Biden said he could go along with, President Biden. So at long last, we seem to have solid support for doing that. Now, of course, the insurance industry and others will fight that tooth and toenail. And it's important to note that among those who will be opposed to it are hospitals, big hospitals, because they fear that if more people are covered under the traditional Medicare program, they won't be paid as much as they are able to be paid by private insurance companies. And that goes to another point. Private insurance companies cannot, nor are they very interested in controlling cost, because the more hospitals jack up their rates and drug companies jack up their rates, because they're the only game in town, insurance companies can demand higher premiums. So they get more and more revenues. Uh, that's how United and these other companies have been able to amass such big fortunes and convert so much um, into profits. I think maybe even folks in Minnesota might be surprised to know that United Health Group now is the seventh largest company in America.
I thank you for that answer. And I know in my own family, Ken's in mind, we have someone that is on Medicare and disability, and she had to have a GoFundMe page because she couldn't pay for her expensive dental bills and vision bills, surgeries. And this just shouldn't be this way in this country. Because, they make you, if you're going disability, they make you spend down, have not very much profit or, assets. But then at the same time, you have something happen to you and you can't afford it. It's just not a fair system at all that we have.
No, we have so many people who have their families have been ruined financially because of healthcare, even if they have health insurance. A lot of the people who turn to GoFundMe, as you know, they have health insurance, but it's very inadequate. One of the things that has happened since I joined the industry many years ago is that every year you're paying more for policies that are less valuable. There's a term for it in the insurance industry. It's called benefit buy down. And that means that insurance companies in various ways are able to diminish the value of your health insurance so that you're paying more or having more difficulty getting the care that you need, even with insurance.
Well, thank you for that. And before we go on to the next question, I did forget to say at the beginning, we do have pre-submitted questions, and we will look at what people have put on the chat and make a copy of it, and perhaps we can email and answer your questions later. Because of the flow of the evening, we probably won't be able to answer them right now, but we will try to address them later. So we want your input is valuable. It is a people power movement and an exchange of dialogue. So we're going to go on to a lack of affordable, accessible care. Now more than ever, with living through the pandemic, we have become awareness of how much our free market system of healthcare is broken and doesn't work. Many can think they can get access to care by going to the emergency room, which is true. They won't be denied access because of the Emergency Medical and Treatment Labor Act. However, hospitals are left with the bill, patients are left with the bill, many go bankrupt. And so we want to talk about your visit home to Tennessee and how you borrowed your dad's car to go to Wise, Virginia, and what you saw when remote area medical services provided free care.
I've lived in the Northeast now for about 25 years working for big insurance companies, and I'd flown back to visit family in East Tennessee. Actually, 2007, I picked up my hometown newspaper and read about something called a healthcare expedition that was being held at a county fairground not too far away. I'd never heard of anything like this. I decided out of curiosity to go up there. So I borrowed Dad's 98 Oldsmobile and drove up Highway 23 from Kingsport, Tennessee, across the state line into Wise County, Virginia. And I've often referred to that road as my road to Damascus because it led me to a scene that I had a hard time believing was in the United States. When I walked through the fairground gates, I saw people standing in lines that were stretching out of view. The folks were soaking wet. They were outside, and they were willing to stay there in the rain because it was their only shot at getting the care that they needed but couldn't afford. And Carol, I saw that a lot of those lines led to barns and animal stalls. Again, this is the county fairground. And it just did something to me when I took that in and realized what was happening. And I had to I had to take some responsibility for it because a big part of my job was to mislead the American public, to get people to think that we have the best healthcare system in the world and that health insurance companies are an essential part of our healthcare system. When what I did for a living was to enhance shareholder value. That was my top job objective. And that meant that first and foremost, I and every other member or employee of the company had to think of the shareholder as our first priority. And that's the way it is in these big companies. I also realized that what I was doing for a living was just the exact opposite of what I tried to do in my first career. Not a lot of folks know that I was a journalist, a newspaper reporter uh, right out of college. And I got lucky. I covered politics in Tennessee and in Washington for a few years before I got into PR work. And I never in that career knowingly lied to anyone, knowingly misled someone, never knowingly obscured any important information. But that's exactly what I was doing and being paid a lot more for it than I was paid as a journalist. I was ashamed of what I did, what I was doing at the time. And I made a commitment that day to figure out some other way to earn a living. I also realized that if I hadn't been lucky, if my mom and dad hadn't put away some money every paycheck so that I could go to college and get a good job, I might have been one of those people standing in those lines waiting to get care in a barn.
Okay. Well, I do have a little personal connection to that. I still have a sister that lives in Tennessee and nieces and their families. My parents were down there because my dad worked at the VA in Johnson City.
Yeah.
And I graduated with my first nursing degree at Johnson City. So I love that area of the country. It's just gorgeous.
I don't know if you know
So,
this, but I grew up 15 miles from there.
oh, I do, because you had said that. Yeah, I do know that. And I love that area. But knew my husband then as a boyfriend, and we became engaged. So we went back up to the upper Midwest where we were both from, and that's turned out okay. We're going on almost 46 years. So he was a doctor too, and he still is, just retired. So we're going to move on to when we talk about, we have an own Minnesotan that we have discussed, my neighbor, and he's become a friend, a former professional bike racer, mountain bike racer, and owns a bike shop and loves to get out and have people put a smile on their face in Minneapolis, the #1 bike city. So here we are going to watch Gene's story.
Hello, my name is Gene Oberpreller. My wife and I own a small business in Minneapolis. We've had it for 21 years. We have had an impossible time trying to get insurance for our 3 kids and ourselves and our employees. We employ up to about 10 employees at times. We found out we did not qualify for Obamacare because everybody said just go get Obamacare, but we found out we didn't qualify because we make too much money. And the reality is we don't make a lot of money. We just employ people. We have to put food on the table. Our premiums, if there's a catastrophic premium that we had to get 3 years ago, was $25,000 a year. And as a small business, that's not possible for us. So Wendell, my question is why can't we get insurance? Because we can't afford it. Do you have a solution?
Well, thank you, Gene. And his story, unfortunately, is not unique. Uh, in fact, a majority of small businesses in this country can no longer afford to offer coverage to their workers. It's been something that's been happening for a long time. And people are not paying attention to the fact that our employer-based system of health insurance is crumbling. And that means that a lot of people who are self-employed or have small businesses don't have insurance. In many cases, like Jane, they They are not eligible for subsidies through the exchanges, the Obamacare exchanges, because they presumably make too much money. And even if they did, what the Commonwealth Fund found in recent research is that about 40% of people who get their coverage through those exchanges are underinsured because of high deductibles. The Affordable Care Act allows insurance companies to make individuals pay more than $7,000 out of their own pocket before insurance will kick in, and over $14,000 for a family. So that's not really insurance. That is something that is just absurd for us to think makes any sense. And what we need, of course, is to have a single payer healthcare system. We need to expand, improve and expand the Medicare program, which has been a publicly funded, privately delivered healthcare system that's been available to people when they turn 65 and people with certain health conditions for more than half a century. So that's, in my view, the ultimate solution. I see that as a means of getting to where we need to be, and that is to have everyone in this country covered, and to be able not only to have health insurance, but to be able to have care that doesn't send us to bankruptcy court if we actually get sick or injured.
Well, I'm glad you mentioned the improved Medicare for all, because many people think that it would be based on the same Medicare benefits, which aren't enough. It doesn't cover enough, costs people too much. Many people that are on limited income can't afford their medical care besides going to the hospital. And also doctors and providers are also concerned that they would not get reimbursed enough, which both our state plan, Minnesota Health Plan, and HR 1976 talk about global budgets, negotiating regionally for prices so that there would be fair prices, not for for-profit hospitals and doctors and clinics wouldn't get what they were wanting, but I haven't seen any Canadian doctors complain about their salaries, so which should be a similar system.
It's a legitimate concern that doctors have, that they might not be able to be paid adequately to keep the doors open and to serve patients. So as part of our effort to get to a single payer healthcare system, we need to take a look at how doctors are being reimbursed for the care that they provide. The bill that you referenced in the House in Congress, that Congresswoman Camilla Jayapal and Congresswoman Debbie Dingell are the lead sponsors of, would help address that, in particular for hospitals, by establishing a global budget that would make sure that all hospitals are paid adequately and paid fairly. In our current system, a lot of small hospitals, rural hospitals, are not. They're on the verge of going out of business if they haven't already. In my home state of Tennessee, more than a dozen rural hospitals have had to shut down in recent years.
And then if we further this discussion, when we talked about expanding the Medicare benefits, then it would be a public pay, and we would not have Medicare Advantage and the Bs and Ds and paying for it, so that the administration costs would be weighed down. Am I correct for that?
That's correct. One of the reasons we spend so much for healthcare in this country is because we spend so much needlessly on administrative things. And that's because we have a multi-payer system. Every doctor's office, every hospital has to have people on staff who do nothing more day in and day out than deal with the complexity of a multi-payer healthcare system. Every health plan, every company does things differently. And that means that we waste so much money. It's been estimated that about 30% of what we spend on healthcare, of the $3.8 trillion, is mainly because of the unnecessary administrative cost that doesn't help us get well or stay well.
Thank you. And then just briefly, I think we should discuss it since we're kind of on a roll here. A lot of people have talked about public options But the public options that actually include the insurance company, where it's a buy-in to what we already have with the private market, you add one, am I right? I think we add one more layer and we still keep that 30 cents administrative waste for every dollar rather than a public option that would be like expanding Medicaid or Medicare.
Yeah, you have to be very careful when you're talking about a public option. It makes all the difference in the world how it's structured. And, and you're right that if you have a public option, you're not really necessarily addressing what we just were talking about, those high administrative costs. Um, I, States are looking at a public option, and some states have passed bills that would establish something like that this year. They're not single payer bills. They are bills that are based on good intent to try to get more people covered and not be in the ranks of the uninsured. But you're right, it's not a solution that meaningfully, if at all, reduces the administrative cost of our healthcare system.
My concern, if we do some of that, and it's not like an expand Medicaid where they're administering it, like the state of Minnesota, if we expanded Minnesota Care, if you do it just as another layer, my concern is, and people will say, well, we tried, see, we tried a public plan and it didn't work because we didn't save money. We're still spending too much because it really doesn't. I'll let you answer that.
Well, it's a very legitimate concern, and I've cautioned folks from even calling what some states are passing as a public option because it's they're different approaches, and sometimes they've been called a public option, but they're pretty different from the public option that was proposed initially more than a dozen years ago that Congress was considering. The devil's in the details. There's no doubt about that.
Okay, well, we are going to move on to inequities of healthcare. We have also heard stories of many of our frontline workers in the pandemic getting COVID-19 at higher rates. In Minnesota and across the nation, many are Black and Latinx community members. Well, one of our own members of Healthcare for All Minnesota, an activist with us, Dr. Naj Musi, a St. Paul doctor, is here to tell her story.
Hello, my name is Najaha Muse. I was born in the Oromia region of Ethiopia. When I was 7 years old, the Ethiopian government at the time attacked our small village, and many families were killed, particularly those who were ethnic Oromos or those suspected of having opposing political views. My father gathered 5 of his children and sought refuge in a refugee camp in Kenya. There I witnessed poverty and also poor health on display. People living in close quarters, coughing from tuberculosis infections and other respiratory infections, and basically women giving birth in really unsafe conditions. Like my family, many of those refugees ended up finding a settlement in the Twin Cities, mainly in St. Paul, Minnesota. They tend to live in housing projects in the Twin Cities where they live paycheck to paycheck. A significant number of them face debilitating illnesses and insurmountable medical debt. In medical school, I took an oath to prevent those conditions from happening to my patients as a healthcare provider, particularly in communities of color because they are disproportionately affected. The COVID-19 pandemic has shown us that healthcare for all Americans, especially communities of color who are disproportionately dying, is a necessary human right. My question to Wendell Potter is, in your experience as a healthcare executive, what weakness in the healthcare marketing industry do you see that could help physicians and providers promote a single-payer health system? Thank you.
Yeah, Dr. Musi tells a compelling story, and there's no doubt that people of color are inordinately disadvantaged by our current healthcare system. A lot of doctors are, more and more doctors are getting on board with single payer healthcare. I've seen that over the past several years. And Physicians for National Health Program has been around for a long time, and there are thousands of doctors, many in Minnesota, obviously, and all across the country, who support moving to a Medicare for all single payer healthcare system. One of the reasons for that is because doctors are increasingly waking up to the fact that while they might be paid more or a higher rate than the current Medicare program, they have to jump through hoops now to be able to treat their patients the way they know they should be treated. Insurance companies have erected many different barriers over the past several years that make it more and more difficult for doctors to provide the care that they know their patients need. There's even a term that came out of war that is being applied to the medical profession, and that is moral injury. A lot of doctors are really affected by it because they know that they can't provide care to their patients the way that they should because of the particular insurance company or benefit plan that their patients have. Notably, the American Medical Association is, I'm not going to say coming around to support Medicare for all, but there's been a lot of progress there. The American Medical Association dropped out of a propaganda group, a front group that is funded with industry money called the Partnership for America's Healthcare Future. At the very beginning, the AMA was a part of that. But because of pressure from membership, they dropped out. I've talked to some folks at the AMA and other medical societies, and I hear stories all the time about just how disgusted and fed up doctors are with their current system.
Well, it sounds like we all need to join together. And I will say, you know, I'm a real advocate and one of the co-chairs for our Faith and Justice Committee in our church, Calvary Baptist on Blaisdell in Minneapolis. And one thing that we are becoming more and more aware of, okay, even with healthcare, it is one thing that we can make better and more accessible and more fair, but it won't take away everything else we need to improve in the Black and brown communities, like having more hospitals in their area, having accessible primary care in their area, finding out what makes them more comfortable about going to the doctor and having healthier baby and mother outcomes. We are doing that in Minnesota with our Voices, Our Health, Stories, Our Health. They are going right into the communities and working with them. So it's not single payer will, if we get there, and that's my dream, and I think it's your dream, and our goal to get there, we still have a ways to go with structural racism, and to just be aware of that, I think.
No doubt about that. We have so much implicit bias in our society, and as we noted, people of color in particular are disadvantaged because of our current system. Even people who are of color but have insurance. A study out of Boston University recently showed that Black women are less likely to be screened for breast cancer or to get treatment in a timely fashion if they have breast cancer, even with insurance, and largely because they're in high deductible plans, and people who are of modest means are really find it very difficult to get the care that they need.
I did see something in the chat I think we should address because it was a little confusing. Dr. Busey said, somebody asked, is pressure from a doctor a weakness in health insurance companies? To me, I think she was asking, Wendell, is what weakness would the insurance companies have where doctors could use their advantage to get single payer passed instead of have a multi-system? I'm thinking that might be what she was looking at too.
What weakness in this?
Well, okay, so what is there if our multi-payer free market system that is a weakness in how they advertise or lobby or whatever, that we can then organize as doctors to get a single payer system going?
Um, and what vulnerabilities in their system?
Oh, Dr. Najmusa just said leverage that we could use as doctors to get a single payer system. That's what she meant. What can we use as leverage?
Well, we have to have doctors for one thing. We don't need insurance companies. I'm not necessarily sure I'm still following the question, but doctors know more than anybody else what their patients need, and they are increasingly aware of how they're not able to treat their patients as they should. Doctors need to rise up and tell the public about this. It's what I do through my organization, is to try to point out the shortcomings of our current system. Uh, we go through year after year putting up with our current system because most of us are healthy in a given year. We don't get hit by a bus. So we don't test the limits of our coverage. I think doctors can play a much better role in educating the public, the media, policymakers, so that we all can have a better understanding of just how our healthcare system has deteriorated and how it's being shaped in ways that benefit and profit a few people who are shareholders in big for-profit companies and their executives. But I think one of the things when I was in my old job, we had a lot of medical directors, and I'm sure Cigna still does. I know United has thousands and thousands of doctors they've hired. We always would try to put a doctor in front of a TV camera if there was an opportunity to do that, to try to convey the message that people in these who work for these insurance companies are doctors who really care about patients. It's phony, and they use doctors in that way just to try to bamboozle the public. It's part of the propaganda campaign in many cases. So doctors, I think, need to really rise up and push back. They're very, very, very busy. But I think it would be something I think would help this movement along if doctors could do more than sign up and be a member of PNHP, for example, but try to work together to figure out how their voice can be heard more than it is right now.
Well, Dr. Musse's put another question in the chat, so since she's our video storyteller, I'll mention it and then we can go on. Would private practice and self-pay payment systems be an advantage?
No, absolutely not. It might have been when I was a little boy, before healthcare became so unbelievably expensive. And there are a lot of doctors who are in concierge practices. They don't take insurance. A lot of people do self-pay. They have no insurance. They have no alternative. But it's not a solution because not enough people have anywhere close to the amount of money that's necessary to cover medical care these days. I'm going to go back to mentioning the unconscionable level of out-of-pocket requirements. The Federal Reserve recently put out a report that showed that close to 40% of Americans don't even have $400 in the bank to cover an emergency, and much less $14,000. So people don't have that much money. We've lost purchasing power. The cost of medical care has risen far faster than wages in this country.
And the federally funded clinic are a place to get basic care on a sliding fee or a free scale in some of our county hospitals. But then if you have to have more care, specialized care, then you're not getting that. So that's right. There's so many needs out there. So thank you for answering those questions. We are going to, Wendell, take a break right now. and I'll come back and ask another question from one of our local Minnesotans and a few more questions. And so we're going to go see how our donations are going. Oh my goodness, look at this. Thank you so much. $2,750 beyond the ticket price. Thank you so very much. Now, if just 30 people gave $20, I'm going to act like I'm on National Public Television now. You can make a difference. You know, you think of Gene, brave enough to tell his story, and Dr. Naj Muse coming from Ethiopia. We have the largest East African population in Minnesota, and wanting to, heart and soul, to be able to give of her time so that people in her community and people in St. Paul can get care. Can you go to the chat right now and click that on and give tonight so that we, the three groups that are sponsoring this tonight, can fight to make healthcare a right and look at some of the things that we can do to even advocate for expanding Medicare, lowering Medicare age, and putting pressure on our legislatures. And we have a big win here in Minnesota. Betty McCollum signed on to HR 1976, and that's the kind of organizing it takes to win. So thank you, and I hope you can go into the chat right now to donate again. Okay, Wendell, we're back together. And
Great.
go ahead.
You have a future in this if you want to keep this up. Thank you very much.
Well, a few people say I'm kind of a natural PR person when I recruit people to do things, so thank you. I've been practicing too, as you know. Well, I hope it works because we really do need you, the people attending, and we will look at that at the end of the session. Even a little bit if everybody gives something. So we're going to transition back, and in my last third of my career, I was a diabetes nurse specialist, helping especially patients with type 1 diabetes, working with their daily needs, their insulin, their pumps, their continuous glucose monitors. It was really the source of joy of my life. But through that, after that career, I got to know a mother, Nicole Smith Holt. And I am just going to let her tell her story because nobody says it better.
So my name is Nicole Smith Holt, and I am from Richfield, Minnesota, and I'm here to tell the story of my son, Alex Smith. My 26-year-old son, 27 days after aging off of my health insurance, died from diabetic ketoacidosis as a result of rationing his insulin because he was asked to pay $1,300 for 1 month's supply. Not a single country in the world other than the United States of America allows this to happen. So I ask you, what can I do to stop this from happening to somebody else?
Such an emotional story, and Nicole, I'm so sorry for your loss. You know, you've lost a son, and we've lost what he would contribute to this world. We lose people every single day because of their dysfunctional and unfair healthcare system. In fact, it was the death of a young woman that was really the final straw for me. Even people who have insurance die every day needlessly because we have private insurance companies calling the shots, not just in Washington and St. Paul, but calling the shots as to whether or not we'll get the care that we need, that our doctors say. Natalie Sarkeesian was 17, needing a liver transplant that had been scheduled when Cigna said that it wasn't going to cover that. Long story short, Cigna ultimately reversed that decision after a huge amount of bad PR. But it came too late, and Natalie died at the age of 17, just a few days before Christmas in 2007. And I left my job soon after that. It breaks my heart to hear stories about people who've lost their lives, people who've lost loved ones because of their healthcare system, people who cannot afford the medicines they need because they're uninsured or because they're underinsured or because some bureaucrat in an insurance company has the power to say no. During the debate on what became the Affordable Care Act, we heard some politicians say that, oh no, we don't want the government more involved in our healthcare because we'll have the government setting up death panels. Well, I will tell you that private insurance companies operate death panels and people die every single day. And partly because the current system excludes about 30 million Americans like Nicole's son, who, for whatever reason, either can't get insurance or can't get the medications they need to save their lives.
So for Nicole and to not ever have it again to another mother and another child that's an adult that ages off the Affordable Care Act or just can't afford it, we did make the movie a little bit briefer. So what she said and what she's told many others, including me in the past, is, you know, her son was working so hard. He was a restaurant manager for a smaller restaurant that couldn't afford, just like Jean's place, to give insurance to his employees. So what happened was basically he was financially getting punished by making too much money. They couldn't afford the subsidies, went to get his insurance, and the premiums were just way too high. And he thought, if I can just ration my insulin till my next paycheck,
That
I
happens
can just
all the time.
ration. I
Yeah,
know.
it happens all the time and needlessly. And often it's a matter of not knowing that there could be some alternatives that could save your life. We have an incredibly complex, confusing healthcare system, and even if there are, um, you know, opportunities for someone to get the medications that save their lives, we often don't know about it and think that we can take a gamble with our lives and skip a dose or split our pills and often with deadly consequences. I learned too, back to that visit at that Wise County Fairground, that most of the people who were there in those long lines had jobs, some cases 2 or 3 jobs, but none of those employers offered benefits. So they were hardworking people, making whatever they could to put food on the table, but there wasn't enough left over to buy their insulin or to buy other medications that they needed or to go to the doctor at any point in their lives, except waiting around until remote area medical operated a clinic over a long weekend close enough for where they live to they could drive to.
Well, you know, over 70% of Americans think that prescription drugs are just too high. So, in an answer to what Nicole's asking about, in the movie Big Pharma, you and Richard Masters, and that's on the Fix It link here if people want to go there to see about watching it later, about having a law that Medicare can negotiate for lower drug prices. There's also pharmacy review boards that can be nationwide and state. Do you want to talk to us about that, about what we could do for just drugs alone in this country?
Yeah, drugs are in many cases inexcusably expensive. And we spend more on medications here than any other country because other countries have some review board, some mechanism that regulates the price of medications for people who live in those countries. We don't. We've just, as Americans, bought this notion that the free market can do no wrong, and so you don't need to have any interference from the government. And if you do, there could be some unintended consequences. So we've just let that ride out for all these years to the point that people are not able to get their medications. There is a a growing movement, and I think it's picking up a lot of steam to enact legislation before the end of this year that would enable Medicare to, at long last, negotiate directly with drug companies to get more affordable prices, like the VA does and has done for many, many years. You can be certain that insurance companies and drug companies will fight that because both industries make a ton of money off of the way the Part D Medicare drug program is structured. So it's not going to be a slam dunk. But if Democrats can pull it off through the so-called reconciliation process toward the end of the year, it might do some good. It would just affect those who are Medicare beneficiaries. We need more to bring relief to the rest of us. Now, all that said, I think and I'm going to go back to high deductibles, and I want to make sure that everybody understands this. Even if that bill were to pass, if you don't do something to really curb the way insurance companies do business, they might benefit and we wouldn't by bringing the cost of drugs down, but they still make us pay a boatload of money at the pharmacy counter. Democrats better not make that mistake.
Well, that's exactly right. To look at how I know when before the pandemic, we had several Minnesotans that rode the bus to get affordable insulin in Canada. And many of them are watching our program tonight because they're my friends and colleagues that I'm involved with in Minnesota Insulin for You. And Bernie Sanders got on the bus with them too. And so and Keith Ellison has talked about how we here in Minnesota could have a pharmacy review board that would set prices for not only insulin, but blood pressure and heart medicines and cancer, and then stop the advertisements. But when I've been preparing for this, I've been watching all the medication advertisements on my favorite channel, Hallmark or MSNBC, and it's constant. You'd think that. And the last job I had was at the VA Medical Center, as along with my husband did. He was a supervisor of primary care there. And it was just such a relief as a nurse to know that my diabetes patients could get their insulin without any problem. I didn't have to worry about them rationing, or they didn't pay their rent, or anything, their needs were met, that they could just get their insulin as they needed it. And the companies didn't mind serving the VA. Nobody said anything about, well, we're not going to come over there and help you guys learn how to do this, whether it was a device or insulin or whatever. So I do think that now think of that, it's 40% less. So there is something to be said for that.
For sure, absolutely right. You all are lucky, by the way, to have Keith Ellison as your Attorney General. I'm proud to call him a friend, and as you know, he was when he was in Congress, became the lead sponsor of the Medicare for All bill.
We are really lucky. Right now, he's been spending a lot of energy for running the trial that Derek Chauvin with George Floyd, our tragedy we had here with him being murdered, not too far from my neighborhood. But now, hopefully, we can also, as we go forward, work on things together in that direction. We are very thankful for Keith Ellison, yes, as our Attorney General. So going on, Susan Patterson has a question for us. These are pre-submitted. In the past, health insurance have used successful campaigns to defeat universal Medicare for all. I am wondering what tactics they will use to prevent Medicare for all becoming law. And if it's passed, what they will do to undermine it.
Well, they will use the same tactic, the same strategy they've used over decades now to try to kill any kind of legislation they don't like. I was part of the effort back in the early 90s, a successful effort to kill the Clinton healthcare plan. The strategies don't change, and the tactics don't change all that much either. It's based on lying. And if you haven't already, you will ultimately see some of these propaganda campaigns on your TV screen or on your social media feeds. It's what they do. And I have to admit that I was a propagandist. So That will not change. They bamboozle the public. They know how to scare people. The tactics are based on fear. There's an acronym called FUD, which stands for fear, uncertainty, and doubt. And all of their campaigns are based on FUD. They want people to fear change, to feel uncertain about it, and to doubt that those who are proposing change are on their side. And ultimately to fear government. And that's why we are in this situation in which a lot of Americans might be willing to say, well, let's keep the status quo because the government would be worse. And in many cases, people think that because of the work that I and my former colleagues did for decades. So, and the strategy includes, as we said earlier, giving a lot of money to campaigns to elect people that they want to have in office, to spend huge sums of money lobbying, and to spend more and more of our money on these propaganda campaigns that, by the way, they spent huge sums of money during the primaries and the early caucus states in 2019 and 2020. In Iowa, this propaganda outfit called the Partnership for America's Healthcare Future spent more money than the candidates spent to try to scare Iowa voters away from candidates that supported universal health care. So that's what they will do. I call their tactics evergreen, their messages evergreen. They just dust them off, take them off the shelf, update them a little bit, and run with it.
Thank you. That was a very powerful answer, and that's what we need to know tonight. We have another question from one of our own board members, Dr. James Hart. Do you see a path for state-based Medicare for All as a way to start, such as Saskatchewan did in Canada?
I absolutely do, and I think it's entirely possible that a state could enact a single-payer system before, and maybe long before Washington does, or members of Congress do. And that is exactly how it happened in Canada. It did not start in Ottawa. It started in Saskatchewan, as he noted, and as you said. There are a lot of states that have single-payer bills, including Minnesota. You referenced the Minnesota Health Plan. The Minnesota Health Act would establish a Minnesota single-payer health plan. Other states have similar bills. And many of them are getting closer and closer to the finish line. Almost happened in New York this year because both the Senate and the House, the Assembly, was in favor of a single-payer bill, the New York Health Act. But the leadership got cold feet at the end of the day, and it never passed. But they got closer, and other states are getting closer as well too. It doesn't mean it's going to be an easy lift. And it's, frankly, back to public option, it is why some lawmakers have thought, well, if we can't get that passed, let's see what we can get passed. And a public option, or some things that look like a public option, have been what they've attempted. And I don't detract from those efforts. I want to say this: when a lot of folks were critical of me a dozen years ago for saying positive things about the Affordable Care Act. And I have been a very vocal critic of that bill, that law. But it has saved lives, including the lives of some very prominent single-payer advocates. One in particular was in Michael Moore's movie, who's become a dear friend of mine. He's probably alive today because she was able to get care because of the Affordable Care Act. So let's not lose sight of the fact that this is a journey, and we need to do what we can, because we're all, as we talked throughout tonight, it's all about saving lives and making sure that people get the care that they need. And we have to be in this for the long haul, and maybe be patient and tolerant of other ideas to get there. I'm a staunch supporter of Medicare for all and single-payer healthcare, but I'm in this to try to save lives, and doing this for my kids and grandkids.
Well, yes, and that's why I talk about ways we can get prescription drugs, or lower Medicare to age 60, or increasing Medicare benefits across the spectrum. The other thing we talk about in Minnesota is if we are going to have a buy-in, let it be a buy-in to our Minnesota Care Medicaid program that is managed and administered by the state Department of Health, so that it is not managed. Right now, we have a lot of Medicaid plans in the state of Minnesota that are managed by the private insurance companies. And then what had happened when I was working actively as a nurse in two city clinics, and I won't mention which larger system, people that know me know it. What happened is they would decide, and a lot of them would be immigrant and refugee clients of mine that couldn't read the English of the letter they got, and they're saying, okay, in your zip code, we've decided to go to this insurance company, or we've decided to go to this insurance company. And then what happened is the people couldn't come see myself and their favorite diabetes doctor, because I'm not saying I was their favorite nurse, even if I was, but their favorite doctor, because all of a sudden, these plans that were managing their Medicaid were making decisions that, and managing, well, this, what would happen is they'd decide that this zip code was costing them too much money, so we're going to let go of it. And then somebody else would have to take up the slack. So that's why if I see a Medicaid expansion, I would like to see it when you can buy into it, that it would be publicly um, administered and financed, but you'd have still private pay, I mean, private care.
Yeah, and a lot of states, unfortunately, have turned over the administration of the Medicaid programs to private insurers. Um, and it may surprise folks, but these private insurers now make more money from the public programs than they do from the commercial side. United Healthcare makes far more money, gets more revenue from Medicare Advantage plans, from the Medicaid programs, from Part D, from Medicare supplement policies it sells, than it does from insuring folks through through their employers or the individual market. Um, so we've got to be mindful of that too. You mentioned Medicare Advantage earlier this evening, and we all need to be keeping our eye on that because they market those plans extraordinarily heavily. Already about a third of Medicare beneficiaries are enrolled in these plans. If we reach the point, and it may happen, that more than half of them Medicare beneficiaries are in these plans operated by private insurers, could be game over for us.
Right. And that's why personally, I really advocate for expanding Medicare benefits and getting Medicare
Exactly.
to be the administrator. And then we aren't having all the private insurances
That's
doing
why
that.
it's so important. And it's also obviously why insurance companies will hate that so much.
It does with people movement. Well, going on, we've talked at length about the problems. Let me see. I have, oh, excuse me, I have two more questions. Sorry about that. Got a little distracted. It's so fun visiting with you. Okay, we have another question from Jenny Jordan. She's a retired dietitian, originally from Northwest Wisconsin, and moved to Minneapolis. She's talking about auto insurance rates and workman compensation rates. And is there any movement among them to support single payer? And would those rates be lower if they didn't have to be paying out claims for medical?
The answer to the first part of the question is no, I'm not aware of it. I don't think I've even read an article that might give us some glimmer of hope that they are. But yes, if we had a system in which everybody is covered and gets their health care needs covered, if you're in an accident, for example, um, you wouldn't necessarily need to have your auto insurance company involved. So there could be a considerable reduction in your auto insurance if we had Medicare for all and show up at the emergency room or whatever the situation might be. If you need medical care as a consequence of an accident, um, your care would be taken, you would be taken care of, and you would not have to pay very much at all, if anything, at the point of service. like happens in most developed countries. So I think it's an interesting and good question that we could see that auto insurance rates and maybe the rates in other insurance could come down.
Okay, thank you. Dr. John Crossan, the co-chair for the Physicians for a National Health Plan of Minnesota, he asks, the U.S. has been a leader in innovation for development of new medical devices and new drugs. Won't decreasing the amount of money going to the medical industrial complex impair creativity and innovation in these areas? We know we hear this all the time.
You do hear it all the time. It's a favorite talking point of the industry, not just out of drug companies, but even out of insurance companies. I can remember using the line that if you, the talking point that if you do anything that might cause any financial harm to insurance companies, you will stifle innovation. You hear that all the time from industries that don't want to have any more government involvement in the way they do business or government regulation. There's been a lot of studies that have shown that most drugs, or many drugs that we all use and rely on, the research is done at taxpayers' expense at institutions, universities, and government entities that do this kind of research. Drug companies play an important and vital role in taking that research and actually taking drugs to development. So that's important. And drug makers, as I said earlier, they do provide useful products, and I can't say the same thing for insurance companies. As we look at controlling drug costs, we do need to be mindful of the need to make sure that drug companies are able to stay in business and have an appropriate return on investment. Many of these companies, though, have profit margins that are really, really high. Not all, but some do. I think the argument is often fallacious that research will dry up and we won't have the drugs in the development pipeline that we need.
Thank you very much. I had to sneak one more question in because when I was out at a Friday party about our exercise-a-thon, a practicing physical therapist that has her own practice, I thought, oh my gosh, we got to ask you this question. She said, I am for single payer. I want my patients to be able to get the care they need without having too much cost involved to them. But if I had to survive alone on the Medicare rates I get reimbursed for now, I wouldn't survive financially. So Wendell, what answer do you have for her? Because she thinks she would be reimbursed by standard Medicare the way it is now.
Well, and I think that, going back to the question earlier, is maybe one of the reasons why you don't have more doctors who support single payer, because it is the concern that they wouldn't be getting enough money to continue their practices for being able to treat their patients the way they should. But it's important for doctors to take into consideration that they have to spend a considerable amount of money that they bring in paying for these high administrative costs that we've talked about, having people on staff who do nothing more than day in and day out deal with insurance companies and the complexity and that is just a part of a multi-payer system, and to have more freedom to practice as they want to practice without having the fear, well, not just the fear, but the reality of an insurance company bureaucrat dictating how they can treat their patients. So there are trade-offs, and I would hope that doctors would be able to weigh the pros and cons and see that even if they might be reimbursed less than they might be currently, if that additional amount from private payers would go away, they still would probably do okay because of the reduction in their overhead.
Well, we look at the reduction in the overhead, but also in the Minnesota Health Plan, HR 1976, it is my understanding that the reason why we call it improved Medicare for all, or in a Minnesota Health Plan, that it is a negotiations board, or people would look at global budgets, or they would submit what they feel they would be setting fees that are better than what we have right now for the
Right.
standard Medicare.
Yeah, that was the point I was going to make, and it's
Yeah,
similar to the global budgeting element of the federal bill as well.
yeah. So that would be better. Well, we've talked at length about the problems. We know our system is broken. In your book on the take, You Do Not Leave Us Without Hope, you quote, winning back American democracy is not a logistical or technical challenge. It is a matter of political will. It is game changing when everyone participates. Wendell, how important is the people movement to this cause of single payer?
No, it's you can't underestimate or overestimate the importance of it. It's essential. And I take every opportunity I can to talk to folks in forums like this to say, I'm grateful that you support single payer healthcare. I would love it if you would have the ability to give some time, some space, I mean, some of your resources to the effort to get big money out of our political system. It was dismaying to see what happened in the Senate this afternoon with Republicans blocking the voting rights bill. It's called that, but it is a bill that would do a lot to clean up our political system. We need to really get behind efforts to clean up our political system, to restore our democracy. And I don't use that word lightly. We've lost a lot that we think of as our healthcare, as our political system. We have a situation in which big corporations really call the shots. And so often legislation that is supported by the public in large numbers never sees a light of day because insurance companies or drug companies or whatever the industry might be fears that their money would be reduced somehow. So it's important to stay in the fight for Medicare for all, for single payer health care. But just look, why have we not gotten there yet?
Mm-hmm.
You see poll after poll that shows majority support for this at the federal and state levels, but we're not there by a long shot. And the reason is because the nation is on the take. Politicians are beholden to these big corporations. Until we really get behind in meaningful ways the efforts to change that, we're going to, 10 years from now, be having the same conversation.
Well, I hope that's not the case. And before we move on to Rose Roach, the Minnesota Executive Director of Nurses, to tell us about call to action and help us know how we can build that people movement, you have left us with hope. And we want to thank you so much for joining us for this Minnesota virtual event. It's been truly very delightful to have you with us.
Thank you so much, Carol. I really appreciate this opportunity and hope we've raised a few bucks.
I hope we've raised a few bucks too. We'll find out after Rose talks with us, but it's not just a fundraiser. It was getting to know more about you and about our Minnesota stories and coming together. But we do need, you're right, we do need to have money to fight and to bring this movement forward. So thank you for joining us tonight.
Thank you, Carol.
Okay, and so now I'm going to introduce Rose Roach. Rose Roach serves on the Minnesota Board of Healthcare for All Minnesota, but she is also, she is Executive Director of the Minnesota Nurses Association. She joined Minnesota's Nurses Association as Executive Director in October 2014 after 25 years advocating for the labor movement in healthcare in Minnesota and California. Rose came to Minnesota, MNA, from the California School Employees Association, where she was a field director. I will let you read the rest, because I don't want to mispronounce anything, or she can tell you. But Rose, there is no one better in the nation to bring us to a call to action of what we should do for single payer and what we can do tonight. So I am going to turn it over to Rose. Thank you.
Well, thank you so much, Carol, and good evening, everyone. I'm trying to start my video and it's saying that it won't let me do that, that a host has to allow my video to start. So I will hope that someone can maybe get that started for me. So good evening again, and greetings to everyone of health from your nurses. You know, Wendell, my friend, thank you. You are such a hero to the healthcare justice movement in this country. It was so wonderful of you to share your story with us, but also I want to thank you for your courage for shedding much needed light on the inhumane and egregious business behaviors and practices of this industry that is really set up to deny care as opposed to allow people to get the care that they need. You know, this comes down to a fundamental question for all of us. What do we want from our healthcare system? Do we want a system that forces 27-year-old diabetics to ration life-saving medication, thereby causing their death? Do we want a system that ties our healthcare access to employment while hampering entrepreneurship and causing families to fear bankruptcy just to stay healthy? Do we want a system that bases healthcare access and services on the color of our skin, our immigration status, or our gender? I can tell you this, that's not the healthcare system that nurses want. They want a healthcare system that's focused on patient health need and not corporate financial greed. And isn't that really what all of us want from our healthcare system? We have the great fortune to be experiencing an historical moment, one that last presented itself following World War II, and we missed out on it. We're coming out of a public health crisis of unprecedented proportion. So we don't have the luxury of sitting back and waiting for others to fix it. We must not let this opportunity pass again. It is up to each and every one of us. We must act. This moment is so critical for this country's future, it cannot be understated. Now is our chance to flip the narrative on this myth of scarcity, that resources are extremely limited and one group's gain is automatically another group's loss. Let's instead talk about our collective abundance. We have the resources, but we need to strengthen our political will because our vision can't be achieved in a system that falsely says either healthcare or infrastructure, either jobs or environmental regulation, either schools or tax cuts. We can and we should fight for the world that we want for ourselves, for our loved ones, for our community, for our future. Florence Nightingale, born over 200 years ago, said to us how very little can be done under the spirit of fear. Well, no more fear, only courage, no more despair, only hope, no more idling, only action. So what do I mean? And what does action really look like? Well, it's pretty simple. Sign up for updates and donate to the Center for Health and Democracy, Wendell's nonprofit organization that works to transform America's system of health coverage based on a core belief that healthcare should be driven not by industry profits and greed, but by the needs and rights of every American to get the quality care they need without concern for cost. If you are a physician, a medical student, or a health professional, join PNHP Minnesota. The work PNHP does, particularly around education for peers in the medical field, is unparalleled. PNHP aims to restore the primary mission of physicians acting as professional advocates for patients. And join me as a member of the Healthcare for All Minnesota organization. Our sole mission is to achieve, either at the federal or state level, a patient-centered, guaranteed health care system with no barriers and no exceptions to the access to that care. We are leading the effort to bring together healthcare justice allies from around the state to discuss the potential for a statewide campaign to win the Minnesota Health Plan. HCAM has a long list of expert speakers for presentations at events that you can help us create. Does your religious organization have a social justice group? Invite us to come and speak to them. Do you belong to a Lions Club or a Rotary Club? We have speakers who specialize in talking with business owners about this important issue. Are you a union member? I'd love to come and do a presentation on why labor is best positioned to lead the fight for healthcare justice. Have a house party. We'll be there. Work with your local League of Women Voters or your political party or a legislative representative to schedule a healthcare town hall. We're happy to help and provide a presenter. Then be ready to go door to door to talk with your neighbors about their experience with our current healthcare system and what their hopes are for what a healthcare system should be and could be. Or phone bank to bombard elected officials' offices with constituents' calls demanding that they support the Minnesota Health Plan or Medicare for All. And when HCAM says, let's hit the streets, and we will, along with the nurses, and we march and we rally at the Capitol for the healthcare system we deserve, you better have your walking shoes ready. I want to thank you all tonight for your donation in attending this amazing event. Please, please consider future monetary contributions to these grassroots organizations so we can continue to do the necessary work of educating, organizing, and mobilizing to win guaranteed health care for all. As you saw, the links to these organizations are on the screen and also in the chat. So let's inspire to be our best by caring for each other again, by putting healthcare decisions back into the hands of healthcare professionals, and by protecting the public's health so as to protect our own and the health of those we love. Si se puede, everyone. Yes, we can, and indeed, yes, we must. Now I'm going to turn it back over to Carol Engelhardt, our wonderful moderator and organizer for this amazing event. Carol?
Thank you. Well, as she said, you can join any of these organizations for free by just getting their updates. So please do join our organizations. So right now we are going to see, this is a fundraiser, so let's look at our forgiving site and see where we're at. Okay, while we're waiting to get this up, I want to thank you for all of you for coming and also for what you have given so far. And we are going to see on the screen share where we are at with this. And we have one more announcement to make about a great event in September. So stay tuned and stay with me here. Okay. Wow. I am so proud of you. We're at $3,855. In the chat is the donation button again. And by giving a little more of yourself, can you help us reach? We want to make 5,000. You can act in two ways. You can act by joining tonight so you can get the updates, and so that if we have like a pride table that we need to have volunteers so more people can sign up, or if we have a lobby day or a neighborhood party where we want to invite people or find out more about it, if you sign up, then you will know that. For Center for Health and Democracy, you can stay in tune with what Wendell's group is doing to bring the pressure on and have us know nationally and what's going on in other states around the nation too, by supporting Wendell and his group to go forward with this. But tonight, your donation goes to all three groups I mentioned. A percentage of the profit goes to all three, which is Healthcare for All Minnesota, Center for Health and Democracy, and Physicians for a National Health Program of Minnesota. So I would ask you to try to donate one more time. Let's see. Now, I want to thank you so much. I want to thank you for coming tonight and taking of your time to be here. And we also want to thank our wonderful team. We started out with quite a few of us in the spring. So we want to thank Jen Crawford, the Executive Director of Physicians for a National Health Board of Minnesota. She did a wonderful job with the videos. She and I interviewed the people and had them set up, and she did a great job of editing them. And we want to thank Dana Kolatar, the former coordinator for Healthcare for All Minnesota, and she helped us do many things to get this set up. Renee Carterell, who's one of our producers in the background and helped us with national marketing plan and getting our every action going. And Jessica Koffenberg, who was also producer in the background, putting our slides, our invitations, and helping us do this. Cheryl Quick also served on the committee. And I want to thank everybody on the board for supporting this so much, and all of you, because you know what? And of course, Rose Roach for doing the call to action and serving on the board. I forgot that. I need you. We need you. It's not going to happen unless we become a people movement. There's been a big movement to stop line 3, and I hope it happens. We need to get in power and say we are stronger than these blankety blank advertisements that are constantly going over the TV to get me to buy every drug imaginable if I had a disease I didn't even know about. We need to be stronger than that. We can do this. We can get our legislatures to say they want to go on board. So this is what we want to be able to do, and I thank you for coming. But I want to tell you now what we have to look forward to in the fall. We are so grateful that Papa John Colstead, legendary jazz and musicians, is going with his band, the Hot Club of East Lake, is going to do a concert that benefits Healthcare for All Minnesota and Crooners. A part of the proceeds for your beverage, your drink, buying your ticket on September 9th, Thursday at 6:30. It's going to be a live event on the main stage. So you'll get more information in your emails. If you sign up to get our updates, you'll see the email updates to get an invitation. You can go directly to the Crooners site, to Eventbrite when it gets out there to buy your ticket. Anybody, invite your friends and neighbors. So let's get on those dancing shoes. Let's get your party on. Thank you so much for coming tonight.
I wonder why the southbound train don't run. I wonder why the southbound train don't run. You don't need no telling, 'cause you know just what you done. I got my ticket, I'm holding it in my hand. Got my ticket, yeah, and I'm holding it in my hand. I got a real good woman, but the poor fool don't understand. I'm a hard-working man, to be mistreated where I go. to the lowland, and I won't be mistreated no more. Jackson, green was where I belong. Gone to Jackson, green was where I belong. Any place in Mississippi is my native home. I'm like my mama left me, ain't done nothing at all.